Hello, my name is Sherry Mustaine. I'm a social worker calling from the Redwood Nursing Home. May I please speak with Jeannie Cook?
This is she. Is everything okay with my mom?
Yes, she's managing well with the COVID-19 despite our current restrictions. She's in her room playing some solitaire and watching the birds.
Yeah, it's hard for her to stay in her room, but we've had some nice chats. I call as much as I can.
That's very nice. She really enjoys those conversations. I'd like to start by confirming that you're aware that your mom assigned you as a healthcare proxy. Is that correct?
Yes, that's correct.
Okay, good. Can you tell me your understanding of your role as a healthcare proxy and responsibilities?
Sure, I'm the one who makes her healthcare decisions in the event she can't.
Right. When Mom joined us here at Rosewood, we completed the MOST form. It states her wishes to be transferred to the hospital, resuscitated if necessary, and to be intubated if her level of care escalated. Do you remember that form?
Yes, that's the pink form, right?
Yes, exactly. So I'm calling you today to let you know of a change in your mom's decision and how she'd want to be cared for if she were to contract the COVID-19. I wanted to talk to you first, and then we'll include your mom in the conversation. Is that okay?
She made a change? I'm surprised. We hadn't mentioned it. She didn't talk to me about it during our conversations. Mom's always been a fighter. She'd want everything done.
She is a strong woman. The staff really enjoy that about her. In light of COVID-19, she spoke to the provider about the care she'd want to receive if she were to contract the virus. I know this is difficult for you to hear, but as her healthcare proxy, it is important for you to know this information.
Yes, of course. I'll do whatever she asks, but I'd like to hear more about these changes that were discussed and what she wants to make.
Okay. So during this COVID-19 crisis, she has decided that she does not want to be transferred to the hospital if she were to become symptomatic. She feels she would not survive, and I agree with her, considering her current health conditions, specifically her lung disease. She would like to resume her current code status after the virus is under better control. So that means we'll put an end date on this form, and we'll reevaluate her wishes at that time.
Well, that's a big change. I'll talk to her about that as a healthcare proxy. I didn't realize you could put an end date on that form, but I guess it's a good idea during COVID-19.
Yes. So to be sure we're all on the same page, if your mom were to get very sick, she would not want to be transferred to the hospital, which means we'll keep her comfortable here at Rosewood. We will take good care of her, and if necessary, we'll include the hospice program. Let's pause a second. How are you doing?
I'm okay. This is just hard to hear. Thank you for calling me about this. I'm glad you told me. It'll make my conversation easier with her that I know in advance.
Yeah, it sure is difficult to hear. Thank you, though, for taking the time to listen to your mom's decisions about how she'd want to proceed and receiving her health care if she were to contract the COVID-19. I can see that you'll respect her wishes, and I bet that's one of the reasons she chose you. Can we include Mom in this call now?
Sure, I think that's a good idea.